All right, everybody, I'm Megan, and today we have the pleasure of hanging out with Liz Hughston, who is RVT in California, and we met in the early stages of the On the Floor website and have had the opportunity to meet in person a couple times, and she's extremely entertaining and chatty, and so I chose her, so she'll hopefully talk more than me today.
No pressure. Thanks, Megan.
No. So welcome, Liz.
Thank you. Thank you. I'm excited to talk to you today.
Yay. So I thought today Liz and I would talk a little bit about work-life balance, which I have always been trying to achieve some sort of balance better than I have had in the past. And so first of all, Liz, just what is your history in getting into the field of veterinary medicine? I know you haven't been doing this your entire adult life, so how did you get here?
Yeah, so this is my second career, I guess technically kind of my third career. I started as when I graduated from college with an English degree and a degree in education, I had no idea what I wanted to do. So I got a job at the Bar Association, Santa Clara County Bar Association. And I worked as a fee arbitration coordinator for a while, and then I was an executive assistant, so in the corporate world at a software company. And then I kind of found my passion, returned to my passion of veterinary medicine. And so I've been a tech now for 7 years, and working in a really busy hospital now, 27 doctors, 24-hour general practice. It's huge. Our friend David Liss calls it general practice on steroids. So we see everything that walks in the door, goats, rodents, birds, pigs, dogs, cats, the whole gamut. So it's I work in the intensive care unit, and we provide the 24-hour care for the hospitalized patients, as well as doing the overnight emergency care. And, you know, I was talking to a friend of mine just today about this, saying, oh, I'm doing this hangout today. I'm really excited, and we're going to talk about work-life balance. And I was talking with a younger colleague, because I'm obviously older. And I've been married for, we're going to celebrate 11 years of marriage this year. So, I'm sorry, 10 years of marriage this year. And we've been together for 20 years. So it's... I'm coming at it from kind of a different perspective than this colleague, who hasn't been married that long. They've just moved to the area from Santa Barbara, and it's really hard for her husband to kind of understand the demands of the job. And Megan, I know you were a supervisor in charge of scheduling and things like that, and one of the big things for her is the requirement to work a weekend day.
Yeah. And
her husband is a little bit... I guess he just doesn't really understand why that's required. And, you know, we don't make it a secret. When we're hiring, it's in the job description. You must work a weekend day. So when you were scheduling people, like, did you have a lot of pushback on that kind of scheduling?
Not too much. We do, we have schedules that are just set. And so we hire into a certain schedule. So when we interview people, we'll say, your schedule is Wednesday through Saturday, your schedule is, you know, whatever it's going to be. And so they know at the very beginning what they're going to work. And then as people leave or move to a more desirable schedule, things open. And so there's the option to move up to something else. But there is some, how come I have to work Christmas again? I've worked the last 5 Christmases. I have worked weekend overnights for 4 years, and it just is, it's hard. And it was really hard as a manager to sit down and say, this is how it is. I don't know what else to tell you. I understand your frustration, but this is what the job requires. And, you know, we have lost people over the schedule. We've lost great people over the schedule, but
yeah, I think holidays too, that's a really good point, because a lot of people say, oh, I haven't seen my family in the last 3 Christmases.
Yeah.
You know, and we have a lot of parents on our staff, mothers mostly, right? I mean, the primarily female staff. And I think that's really been a difficult thing for a lot of people, is that oh, I have to work Christmas again, I have to work Thanksgiving again, or but we have it seems like our group has a lot of support with each other. So I don't have kids. So, for me, Christmas morning isn't that big of a deal. So I'm happy to work Christmas morning and let someone else have that time with their kids.
Yeah.
I'm sure you guys have the same.
Yeah, generally speaking, we don't have a lot of moms, and so the couple that we have, we're always like, yeah, you do that. If I have plans, my family lives a few hours away, and they're always willing to say, well, we'll just celebrate Christmas on the 27th. It's not a big deal, but not everyone's family is that understanding.
Right.
But yeah, that is just, I learned early on hiring people to say, this is what we do, and when it gets too much, I've had great conversations with people, sitting them down and saying, it's okay if you can't do this anymore. It's okay if you're getting pushback from home, that they're not seeing you enough, that you almost have to give people permission to quit when it's in their best interest to do so. Yeah. And that is something that runs rampant through all of us who do this emergency, that we have this such commitment to our patients, to our coworker. Everybody knows when you quit how hard it is to find somebody to come back in who's qualified, and they don't want to leave their coworkers in this lurch, and so people hang on until they're miserable. And
yeah, I know one of the big things for me when I started in this, because I was basically corporate up to this point, and it's so easy to turn off your computer at 5 o'clock. You save your document, you turn off your computer, you go home. And when I started in this profession, my husband he had a hard time understanding. I don't understand why you're supposed to be off at 2:30. Why is it 6 o'clock and you're just getting home? Yeah. And and not only that, but why didn't you call me or text me to let me know that you were going to be late or whatever? And it's so hard to explain to someone who's not in the industry, yeah, or doesn't do this work, to say, well, I was getting ready to walk out the door, and then the patient I'd been working on all night chewed out his IV catheter, and so I had to replace that. And as soon as I got done replacing that, something came in the door that needed emergency surgery, and there are, 3 of us here. So it's not like I could just say, okay, good luck, you guys, and walk out the door. And it has taken him, I would say, we're really just now, so 7 years, kind of getting to the point where he gets it. Having it happened enough time.
That is just time, and him just kind of getting used to it. There's not any advice you have for somebody who is struggling?
I think that, it's nice for me because where I work, it's an open hospital, so we let people to be anywhere in the hospital anytime. Yeah. So I've actually had him come to work. He can come in the back and he can see what's going on and see what it's like. And, I think talking to other people where I work, like, it's not just me. Yes. So for him to understand, because I am that kind of person.
A spousal support group that they can all get together and be like, yeah, totally. Oh, yeah, that Saturday I didn't see her for 36 hours.
Right. And I'm that kind of person who would even if it wasn't necessarily, really 100% needed, I might stay because I felt like I had to help or whatever. So he, it's been good for him to see me doing it and to talk to other people I work with and realize that it really is needed. It's not just, I'm not avoiding spending time with him, I'm not avoiding being at home. It's that they really do need me to be doing what I'm doing. And then it's interesting because I don't know what your situation was when you got your VTS, but so my VTS was also very time consuming. And I think that was another side of it, because it did take so much. It took so much time to do that, and it was such a big part of my life. So between work and that together, there was even less.
He never saw you.
Balance. Yeah. He saw me, but I had my nose in, Silverstein and Hopper. So, so I think that, as far as advice for people, what I told this younger coworker was, find people who can switch with you every once in a while so that you can have a weekend a month, where you don't work and you're home. You get your shift covered by somebody else. You work another shift during the week, and you can be home. You guys can make a weekend plan. You can be home with your husband for the weekend. I think that is a really important thing to do too, to look to make reasonable concessions to the people in your life. You can't be unreasonable. You can't go into your supervisor's office and say, look, you know, my husband's going to divorce me if I don't get off weekends. But you can work with other people that you work with to make those things happen and make it a little more comfortable at home for you. So, you know, she confided in me that that was going on, and I said, look, let's switch a couple shifts, you know.
And what is so amazing to me is that we don't even think about it as a big deal, but somebody would go in and talk to their supervisor and say, I'm going to get divorced if my schedule doesn't change, because a rational person would quit that job. But I think as a group, we're not rational people. Like, we so value what we do for a living that we have put so much of our personal lives in jeopardy because of this commitment that we have to what we do. And I don't think that it's only our profession, but I think it's so much just runs rampant in our profession.
I think that's a huge part of it. I really do. And I think, you know, when I look around my practice, so I've been at that hospital for 7 years, and when I look around and I look at the number of divorces or people whose relationships have fallen apart just in the time that I've been working there, you can't blame it all on the workplace, obviously, but when you see so many in one place, it's an inordinate number, you know, proportionally. So there's something about, I don't know what it is about veterinary medicine, but I think there's something about it, maybe it's the fact that our patients are nonverbal, and so we feel more responsible for them, or, you know, maybe it's those clients that say, you know, well, I don't know if I want to, you know, have it, I don't know what I want the code status to be, but don't let my dog die before they walk out the door. And, you know, that kind of pressure that puts on you to know that you have this very vulnerable family member, that you have the full responsibility of making sure that that dog or cat doesn't die, because the person has said that to you as soon as they walk out of the hospital. That puts a lot of pressure on a staff person, and I think that it's a pressure that your family doesn't understand because it's something they're not subject to. So I think it's even harder if you don't have pets. There are very few of us whose family members, I think, don't have pets.
But even people whose family members do have pets, to understand the lengths that other people will go to. I mean, I have pets, and I have certainly treated animals, and I say I wouldn't do this to my own dog, but I get it. I get the commitment. I get but yeah, that can be really hard for other people to understand, because it gets to a point where they're like, it's someone's dog. I love my dog, but that's crazy. Why are you 15 hours because it's on a ventilator, or it's on renal replacement therapy, or it's had a 6-hour surgery? You know, like, people just look at you like you're crazy.
Like in our hospital, when I tell people the stories about people bringing their hamsters in for surgery, their rats in for surgery, and they're like, I could go to Petco and buy a hamster for $10. But that doesn't take into account that human animal bond, which I think is so important and so not well understood. You know, how deep that can go and how far people will go to maintain that. And I wonder if that has something to do with it too. Why we are so
we understand it so well and need that, you know, and so much of us put our own feelings about our own pets into the pets that we are treating.
Oh, totally.
What would be really interesting is to get like a human Nicu nurse who's working with, you know, newborn babies, and they are also very helpless and nonverbal, and I just wonder, you know, dealing with the parents of these kids, like what type of stuff they're dealing with and what their balance is.
I bet it's really similar. But that kind of brings us to the article that was just in, was it in Veterinary Team Brief or Clinician's Brief?
Veterinary Team Brief.
Dr. Lee's article about the prevalence of suicide in our profession, because I think that it kind of goes along with it. I think if you can have a good work-life balance, you're less likely to feel so despondent, you know, because you know there are other things in your life. But I don't really know where that comes from. Why are we more vulnerable to that problem as a profession?
I wonder, looking at like human nurses and what they go through, and then looking at the veterinary world, and there is the insurance for animals is not widespread, and it doesn't work the same way. It's a reimbursement. You can't just go in and get your animal treated. We have those people who are accusing us of doing this for money, and we don't care about their pet. We only care about money, and so we do have to deal with those stresses. We do have people that put insane importance on their pets, like this was my mother's dog and she died suddenly and now I have it, and now this dog has become my mother and I can't go through that again. Or this dog, this 14-year-old golden retriever, has been with my autistic son his entire life, and if the dog dies he's never going to sleep again. Like, we can't but that happens. I had this little old lady, I was sitting with her and we euthanized her old dog, and she wanted me to come home and have dinner with her because she couldn't be by herself in her house. And like that, dealing with that is an incredible, and a lot of us are single and we can't go home and necessarily have anybody to even just vomit all of this emotion onto. And some people who are married, their spouses, partners can't handle that level of emotion that we need to get out. And
that's a really good point.
It just sits there. There's nowhere. So you can talk to your coworkers, but they've got their own stories, and there's just not, where does that emotion go? And you leave it, and then all of a sudden I can't deal with it anymore.
I think that's a really, really good point. I think it definitely, doing this, like I said, I've only been doing it now for 7 years, but there are times when my husband's like, I don't want to talk about it anymore. Like, I can't hear about it anymore. And I might have a lot of stuff going on that I need to process. And of course, maybe because I'm a girl, or maybe because just my personality, I want to process it by talking about it. And he just can't hear it. And that can be really hard. And maybe that is a big reason why relationships also don't really withstand this profession, because it's hard to talk to people who don't understand what you're going through. And you talk about that woman, and how do you say to that person, no, you really want to be there for them, and you have been there for them in this really intimate moment, in this very emotional, powerful moment, and to then turn around and say, well, no, I can't come and have dinner with you.
I can call you a cab.
I know.
I had to work until 2 a.m. I can't. But yeah, that was years ago. That still sticks with me. And that, I think there's just a lot of, what do you do with that? How do you deal with that? And if you can't, have somebody share that with you, where does that go? And I think, in the article that Dr. Lee wrote, she said it was such a shock. This, I think it was a resident maid of hers had committed suicide, and nobody saw the warning signs. But I think sometimes you just have a vulnerable moment. You've been up for, more than 24 hours, and you have all this stuff just sitting there, and then it hits you. And if there's nobody there at that moment, who knows?
Well, and I think veterinarians versus technicians too, it's the level of debt that they have, the level of responsibility that they have versus ours. I think that can be a huge contributor to it too, because I got my tech degree at a community college, so I didn't have to go into debt to get my degree to do what I wanted to do. But you're looking at veterinarians coming out of school with $50,000, $100,000, $200,000 worth of debt.
And they're not that they're doing it for the money.
Right. Exactly. And they're not making that enough money to really get to see a way out of that debt. And that can be a big contributor, I'm guessing, as well. And that can put a lot of stress on a relationship, because your significant other is doing a lot of work and trying to raise the money, and you're trying to pay off your student loans. And I think that's something we can deal with, the other emotional side of it, but we don't have the financial side of it. Most of us aren't owners, of practices.
Yeah, not feeling that pressure of trying to make everything work and pay employees and be able to do it's hard. Everything that we do relies on people being able to pay for what we want to do, and it just things keep getting more and more expensive, and it's a scary vicious cycle.
Yeah, it's I know this isn't exactly the topic we're talking about, but kind of leading into that with the money side, I was just reading an article about the doxycycline shortage, and you look at a drug that used to be, basically a half a penny a pill, if they even charged you for it at all, because it was generic, it's been around forever, and now it's such a basic drug that we use to treat so many things in veterinary medicine, but also in human medicine, and now you can't get it, and you're looking at someone who's looking at a life-saving medication for their pet, if they're paralyzed from a tick paralysis, or they have some other tick-borne disease, Lyme disease or something like that, and they're looking at $1,000 for a prescription of a basic drug. And that puts a lot of pressure, I think, too, on us, to try and find another alternative, or to scrape up drugs for them, taking other people's unused prescriptions and, putting the pills together.
Keep that responsibility on ourselves to be able to help those people.
Exactly. And I think that's really hard. And I wonder, you made the comparison to the Nicu, and I think that's a really apt comparison. Again, the nonverbal, very fragile, very dependent patients, right? And I wonder what the difference is between that and our patient population, and because of the treatment options that we have. I mean, it's not really a treatment option, but we have the option of euthanasia, and people can make that really hard decision, which at least they're not going to be making that decision openly in the NICU. They're not going to be saying, give a drug to actively cause this to happen.
Yeah.
And I think that's a whole other side of it that they don't deal with in human medicine, at least not openly like we do. I mean,
it's not going to be like, here are your list of options, and that is number 2.
Right, exactly. I mean, you hear the doctors, and I've had those conversations with owners. Well, your dog is 15 years old, and it has this condition, and we can take it to surgery, and it's going to be a difficult surgery. It's going to be a difficult recovery. It's going to be a lot of aftercare. It's going to be expensive. Or maybe, you think about the kind of life he's lived so far, or she has lived so far, and you've given them a really good life, and they've had 15 happy years with you, and is this the time, to make that really difficult decision? And those conversations are really emotionally draining and taxing.
Yeah, because people always want to know, what would you do in my situation? And, you can, as much as you want to say, this is your decision, you can't. You need to, be able to counsel them, and then, for a lot of us, it brings up that emotion of when we went through that decision, and here's what helped me make that decision. And, I really believe that euthanasia is a great thing when used appropriately, but it doesn't make it any easier to have that conversation with somebody. And
no, exactly. And I was one of the tech groups I'm a part of. They were having a discussion about that, and what do you say to a person after, when you're in that situation and it's been really emotional? Do you give them a hug? Do you cry? Like all of these things. And it was really interesting, the range of responses that people had to that situation. So, I'll put it to you. Do you ever cry in a euthanasia, or?
Yes.
Yeah.
A lot of times it's if I've known the patient and I know the owner a little bit, but there have been some just come in for euthanasia that have caught me off guard, and I think it's good for clients to see that. I think they can see that we are connected with them, and that takes away, you're just in this for the money. I know a lot of doctors here that come out of euthanasias and just need to take a second. it's not just a, yep, I'm doing this and I'm moving on to the next thing.
Yeah.
And
Yeah.
I, as hug phobia as I am, I have given hugs to people. Sometimes it's just a pat them on the back a little bit or put my arm around them, but there are those people that I can do that.
Yeah. Yeah.
But I do think that it's important to just be able to show some of that emotion, to just let some of that out, because if you're always trying to stuff it, it's not helping. You've got to have some sort of release. So.
Yeah, we're back to that same issue, right? Of not having somewhere to go with all of that emotion. And I regularly cry in euthanasias. I am probably the biggest. I mean, to the point where some of my coworkers are like worried about me, like, "Are you okay? Like, can you do this?" And I'm like, "No, you know, I'm crying because it's like, for me, it's a gift for a family and a pet to be able to do that. It's something I can't do for my family members, which, you know, having seen some really bad situations, end of life situations, it's hard to not be able to do that for my family, my loved ones, and sometimes it's just so powerful to be part of that super intimate situation, you know, to be present there at the end. So I'd say probably 75% of the time I'm in tears at the end of the euthanasia. Yeah, and I'm a hugger, so I'm hugging. If they look like they want to hug, I'm hugging them 100%. Maybe they don't all want to hug, but I'm a hugger, so they're almost always gonna get it. So
what do you do outside of work? What are your hobbies?
Yeah.
We'll try and turn this around to be.
Well, so that's really interesting because, you know, between the two of us, we probably picked two of the biggest veterinary nerds on the planet. So, you know, I spend a lot of time reading veterinary journals.
Yes, that's why I want to know.
Going to veterinary conferences.
Some ideas, Liz, on what I can do in my off time, because I don't have any hobbies.
Exactly. My hobbies, in fact, my husband, when I finished studying, he was like, "I'm so glad to not see a vet book." Or like, "Can you read something else? Or can you read, you know, a New York, one of your stack of New Yorker magazines?" Or, well, so I have to admit, my big escape is television, and so, you know, we watch comedies or, you know, whatever, and that I use that as kind of an escape because I can really turn off. You can turn off your brain for a lot of it, and I'm
totally with you there. Like the series, and you know, just finding other people that watch them, and like Homeland and Game of Thrones and Dexter and these like super intense shows, which is whatever. But then it's coming to work and it's talking about it, and it's we are at work talking about something that is completely not work related, and we're lost in these characters. I totally get that. That's probably sadly my number one hobby.
And you guys do a lot of other stuff being nonprofit. You guys do like the gala and the dog wash and the dog walk and that kind of stuff.
Yes. So there's a lot of volunteer opportunity and get outside of yourself a little bit.
And then you let your staff do the grief support group too, right?
Yes, if they want to, they can do pet loss, or we can just go see Enid on our own, which
I think is amazing. That's just great to have that resource there, to have somebody that you can go, that you can go and talk to when you start to feel that. You know, I think a big part of it is being able to recognize it in yourself. You know, when you're starting to get to that point where you've tamped everything down for so long that if you don't talk about it, something really bad is going to happen.
So have you been to that point with yourself?
Yeah, I think I have. You know, it's nice because I have a husband who likes to do others, like he likes to travel. He has a lot of family. So I tend to get out pretty regularly, or I'm going to a vet conference, you know, where because I do like all of them. So, you know, so that gets me out of that environment, which is great. then I can go and do something different, even though I'm still kind of nerding out. It's really energizing for me because it's other people who are super nerdy and in the profession, and you can really really talk about it. You can really get into it, and the good and the bad and everything, right? And everybody you talk to is like super interested, and then they want to tell their stories, and that's really great.
It's
but also, yeah, exactly, it's totally cathartic. And I think just getting out, like, everybody feels like the hospital's going to fall apart if they don't take a day off, or the schedule is going to be all screwed up if they don't take a day off. And I think that's an important thing to learn when you're early in your career. Take regular time off. Don't get to the point where you have 300 vacation hours because you've never left the hospital. And don't volunteer to take everybody's shifts, because you want to be a good friend or whatever it is. But the more you do that, the worse it's going to be for you in the long run. So I think that's a big thing for me is the getting out, realizing that there are other people who can do stuff while you're gone.
That's a huge part of it. I agree. Is realizing that because you are not there for a day, the world does not end. I will say, I just took my very first grown-up vacation.
Good for you.
Might be somewhere. It was not a conference. I was not speaking. It was like, I'm leaving town and I'm going to do whatever I want to do, and then I'm going to come home. And I didn't work, but I had been here for 13 and a half years. It took that long.
That's too long
for me to do that, and it was great. And I woke up on day 2 and I almost cried. Like, I'm sitting in my rental car and I have this map of where I'm going to go and spend the day. And I was like, I am so happy right now. And I'm such a dork because...
No, that's awesome. That's awesome.
It was this epiphany that took me 13 and a half years to get to that point. And so it doesn't have to be as dramatic as getting on a plane and going somewhere, but to just say, I have these days off and I'm going to do something for me. And maybe that's just mowing the lawn. Maybe that's just, getting that done. But
going and getting a massage, getting a facial, getting a manicure, a pedicure, right? I mean, something that you do just for you, like you said, not because we do give so much to our patients, to our clients, to the doctors, to the other technicians. And so to do something just for you, sometimes it feels really weird. Like you feel like, this, I shouldn't be doing this.
This is not right, but that's ridiculous.
Yeah, exactly. And I think that's a huge thing for that I try to tell people who are new. So we have the luxury of having a veterinary technician school right up the road from us. It's literally 5 minutes from the hospital. And so we have a lot of interns. And they're super gung-ho, right? They're way excited. They're gung-ho. They want to do everything. And I tell them, like, look, do not let this consume you to the point where you have nothing else, because it will consume you. It's such a strange dichotomy, because there is this, especially in a for-profit practice. I don't know what it's like at a not-for-profit practice, but there's a little bit of this, like the machine, right? The machine is going to keep operating whether you are there or not.
Yeah.
And I know sometimes it feels like that's not true, like you're integral, or it's all going to fall apart, or I don't know. But it's, I think for me, I've talked a lot about my husband on this podcast, but for me, he worked at a big company. He worked at IBM. And so that's a company, like, talk about your definition of a place that's going to keep running no matter who is there or not there. And so, I learned a lot from him, basically, which is like, hey, it's okay for you to do stuff for yourself, to take time off. When you're there, be 100% focused on what you're doing in your job. And when you're not there, leave it there.
Yeah, be 100% focused on being a person. Like, not be the 35-year-old who's like, what? Who am I outside of this job? Like, this will get, we're not going to talk too much about my own personal awakening to not
Oh, come on.
being owned by, but that was my own choice. It's nobody's fault, but it did, like, I had to have this wake up call to myself and be like, you need to have a persona outside of your job. And it's still something that I struggle with, but if I had any advice to any new kids, yeah, be 100% there, but realize that you've got to be your own person outside of that job, because if you let it, it will suck you in. I think across the board, if you let it, it will take over your life, and then you don't want to be somebody who has nothing else.
Now, did you?
It will continue. If I die tomorrow, Dove Lewis is not going to go under.
Exactly. Exactly right.
He wants to think that, but
right. Did you come to that realization? Did you come to that realization yourself, or did someone sit you down and point that out to you? And say
I've had people sit me down throughout my career and be like, you need to, you're doing too much here. Like, you need to go take some time. You're going to burn out. You're not going to be, you're going to be worthless if you're miserable here. And, so I've, pot calling the kettle black. Monica and I have had many discussions about, work-life balance and how to be a little bit more successful in that. And so, but some of it is my own, like, what am I doing with my life that there just needs to be something else. If I meet somebody, what am I going to talk about? I should talk a small portion about what I do for a living, but I should have some, like,
something else
to talk about. The news stories. Here's what I think about pop culture. Like, I should have some opinions other than here's what you should do medically for your dog who's vomiting. Like, there needs to be some more to all of us. So
yes. No, I agree. I think, sometimes it takes another person to say to you, hey, you've gotten a little out of hand,
You're crazy.
Sometimes it's your partner, right? Sometimes it's your supervisor. Sometimes it's a coworker. And I think it's hard for us to recognize in ourselves those signs of burnout. It's easy to recognize it in other people.
Yes. We're super crabby. What is going on?
Yeah, what is going on? Exactly. And I think that's one of the big signs. But, I was reading something about burnout. Do you know that, like, another sign of it is, like, for example, you take a dog for a walk and you don't remember the dog's name?
That's mine. That's my...
Which, to me, I'm like, I can never remember, like, not never, but sometimes I'm like, I don't know, come on, puppy, or whatever. And which would lead us to a whole other topic, which is what is your go-to nickname for every patient? Because we have a doctor at work who calls everybody Meatball. I call everybody Monkey. So, it's like we all have that.
Yeah.
But, anyway. But they listed that as a sign of burnout. And I thought, oh, that's really interesting. And, the idea is that you're not fully present in what you're doing. And that part I get, the not being present part. And I think that is a sign that you're starting, when you start to disconnect from what you're doing, I think that's a sign that you're getting burned out.
Yeah. When it's like when I get frustrated with a patient who has diarrhea on them, like,
right.
No animal, old, young,
right.
Not is going to purposefully do that. And so when I'm like, are you serious? I have to get you out and clean you up again. How come you can't just poop in this corner?
Right. That might be a sign that it's time.
The purpose of my job is to make those animals comfortable. And if I am angry at them because I have to do my job, that is a big problem.
That's a good sign to look out for. Yes.
Yes.
So,
and it's not to the point where you're screaming at them. It's still the internal dialogue. Right. But yeah, it's those little things that I have to say, like, I should take a day off. I should, whatever. And, being honest with each other and just calling somebody and being like, I'm going to freak out. I need a day off. Can we switch? Can you work for me?
Yeah.
To try and prevent that from getting to the point where you're...
I think having management that has either been there, as a technician, as you have, or knows the practice well or is kind of paying attention to what's going on. So, for example, yesterday, crazy day. We had both of our overnight people called in sick, and so we had two people who had to start at 4 a.m. and then it was full hospital and all kinds of crazy stuff. And the practice manager came in and put a piece of paper down and said, make a Starbucks list. And, she just went and got coffee for the hospital, paid for coffee for everybody. And that was great. And that made us all feel so much better, like so much more invested and not just the caffeine energized, but like, oh, hey, somebody notices.
Somebody noticed and somebody understands, and I am appreciated for doing what I'm doing. Yeah, I agree. That's a huge, sometimes it is just getting recognition, and you can go through that burnout if you don't feel supported. It's not just, if you are giving all of this to work and you're not getting that back from whoever, your management, your coworkers, then your clients, that's going to contribute to that as well.
Right. And I think it's hard to recognize that in yourself until something like that happens, right? That when the practice man, like, we knew we were busy, we knew, but we're rocking it, we're just going, we're doing it, and then she comes in and she's like, okay, I'm buying coffee for everybody. You're like, oh, wow, this actually is kind of extraordinary what is happening today, And, oh, I guess there's a reason why I'm feeling kind of stressed out right now, because this is crazy. So, yeah.
Be validated. And
right, exactly. So I think that validation, sometimes it does kind of wake you up to what you're feeling inside, right? A lot of, we can get into the whole psychology of the people who work in veterinary medicine, but I don't think that's what this chat today is about. But, the people who do it because they love animals and hate people, well, we end up working with a lot of people. And so I think we're not necessarily the most self-aware population on the planet. So being able to understand what's actually going on inside of you is its own challenge.
Yeah.
And I don't know how you do that besides just getting older and, talking about it more. And, I think that's a big part of it, is just as you get older, you start to learn that kind of stuff, and about yourself.
Yeah. Figure out where you fit in the world and what you should be doing and what makes you happy and what fulfills you, and, where you want to be in 10 years. And I do think for me, it was easy when I was in my early and mid-20s to pour everything I had, because that's what was important to me at the time. But as you get older, you realize, like, I should have been cultivating other relationships. I should have, these are things that are important to me now, and I still am very invested in what I do, but it's not the singular purpose of my life.
Right. And to realize that you can be invested in other things and not diminish your commitment and passion to your, your calling, because I do consider it a calling for myself. But I do think that for me personally, and I have to say, based on what was going on with my coworkers yesterday, that recognition by management, not just by your coworker saying to you, wow, you're really rocking it out, we're super busy, you're doing a great job, but someone in management saying, we appreciate what you've done. This is so great. Thank you so much. And to not just say the thank you, but to, go and get coffee. Or
order pizza, or
like, we know, and our practice manager has done that before on crazy days where nobody's getting lunch, and it's, she'll order pizzas and have them delivered. Or sandwiches or whatever.
There's popsicles in the freezer, like they're,
exactly.
Here are a bunch of cookies. Here is this. It's little things, but it is. Yeah, I agree. It's managers just being in tune with that, and recognizing that this is a difficult job, and it's, some days are much worse than others, and so it is for me. It's that validation of
we recognize that what you're going through is a lot, and we appreciate what your commitment and your hard work and your dedication and whatever. You kind of, it's a coffee, right? It's like $5, but it can say a lot in a situation like that.
You're still talking about it 24 hours later. It was a cup of coffee, but it means something to you, and that's important.
Yeah, and so I think that goes a long way to preventing like burnout of the shift. Do you know what I mean? Like sometimes individual people aren't feeling burned out, like they're feeling fine, they're doing their thing, but there's an energy in the room, on the floor, that you're like, oh God, something bad is going to happen, right? Like somebody's on edge, and I can feel it, and so something like that changes that whole energy around. You know, it makes such a huge difference. Even if everybody was kind of focused and doing their thing and not really feeling particularly, burned out.
Yeah.
But the energy is going in that direction, maybe, and I think that can make it.
Especially for us, I think our patients pick up on that. Sometimes I'll come in as the day shift, and every cat has a will bite, use caution sticker on it, and I will go in and
everybody's fine.
Yeah, I don't have any problems with this cat, and it's not like, oh, so and so was working last night and they're terrible, but yeah, the just the energy on a shift can really, you get all the animals that are angry, and then the energy changes with the next shift, and it's like, these cats are fine, what is wrong with you? But it's as simple as coffee can turn that around and make a big difference.
Totally. Yeah. And I think so I think really if we wanted to give like a piece of advice to someone who's younger, new in the field, wondering, am I burned out? I think if you're asking the question, if you're not there, you're getting there. Right?
Yeah, I agree with that.
I mean, if you're asking that question, you're getting close to being there.
Yeah. If you're concerned about it or thinking about it, it's time to and it doesn't mean you have to take 2 weeks off and go on vacation, but maybe on your 2 days off, you do go somewhere, or just, for me, go to the coast for the day, or just like get out. Don't think about it. Just get yourself out of it. And
exactly. I don't even, we say get out, right? Go, whatever, but I don't go outside even sometimes. I'll just stay inside, and if we're gonna be a little confessional here, maybe you spend the whole day on Facebook, or
don't shower till 4 p.m.
I've never done that. What?
Maybe you watch an entire season of a TV show all day.
Exactly. But
maybe
seriously,
you forget to feed your pets breakfast. I don't know anything about any of those things, Liz.
Me neither. It's just, for the people watching this video, they might.
I'm a completely responsible adult all the time.
Yeah, I never eat candy all day and not actually have an actual meal.
I've never been to 2 different fast food restaurants in the same day.
Yeah, me neither.
Yeah, no.
No. And there isn't, and my refrigerator isn't full of beer and wine.
Oh, never.
Either.
Oh, so we're going down that road, are we?
No, we're not. Definitely not.
Well, we could go on forever, but this was helpful for me too, just to.
This is great. We should do this all the time.
We should do this all the time, and we can solicit topics and anything anybody wants to talk about.
I love that.
It's fun it is nice to meet somebody who's just as dedicated, but who also can have fun. And, I do think we have a lot to offer the next generation of technicians, and don't repeat my mistakes.
Yes, exactly.
So,
exactly right.
Don't wait till you're 36 to go on your first grown-up vacation.
No, don't. Go now. Don't wait. Where did you go for your first grown-up vacation? Where did you go?
I went to Colorado Springs, and it was beautiful, and I did some great hiking, and it was fantastic. I had a great time.
Did you take Phoebe with you?
I did not. She has an injury that prevents her currently from doing anything, so.
Poor baby.
Yes.
We won't get into it.
No, but
we could talk about our own pets forever.
Good. Yes, we should do that sometime and just have an hour of us telling pet stories.
That would be great.
Really
it's so funny you were talking about the diarrhea and the dog dog's doing it on purpose. So that would be something that I think would be a really good topic, would be, what's the grossest thing that ever happened to you on the floor?
Okay.
So, so the grossest thing that ever happened to me on the floor was I was taking the temperature of a patient, and I didn't have gloves on, and the dog started defecating onto the temperature probe all over my hand and the temperature probe, just all out like a soft serve ice cream machine all over. And then, so that was, I think, the grossest thing that has ever happened to me in veterinary medicine. Although it's a close second to the dog that came in with what was listed as the night before a very severe ear infection. And I was working on the dog. The dog also had bad eye problems, like untreated KCS. And so I was, he's right, I was working on the dog, and it coughed. And I look on my hand, and I'm like, a worm just came out of this dog's mouth. And I look at it closer, and my coworker says, is that a maggot? And I look at it, I said, I think it is a maggot. So then I go back to the dog, and I'm looking in the dog's mouth and the nose. I'm like, where did this come from? And
I have eyeballs.
But I lifted the dog's ear, and it was full, packed full of maggots. In the mouth, in the pocket of the in the mouth, in a pocket, in the ear, packed in the conjunctiva of the eye.
Not okay.
It was terrible.
Okay, I have my grossest one.
Okay.
A large breed dog, like 100 pounds plus, open pyometra, and every time we would run the gauze, like just touch her belly, like pus would come out of her vulva, like just, it was disgusting. So it was just kind of dripping, and we're trying to scrub the belly, and so this was out in doing our rough prep, and we were like, well, once we get her into surgery and do our final prep, we can't have this pus splashing up over. So somebody ran to their locker, got a tampon. And that's what we used so that we could do our final prep of this dog. And then the surgeon came in, like, gloved up, and I was like, wait, before you put the drape on, we need to pull this tampon out. She got so mad at us. That is so disgusting. I can't believe that.
But it worked, right?
It did work, and it was really gross. It was not maggots, but I like that.
I know when you pulled it out, it was really gross.
It was really gross. So there you go. That's a great way to end this.
That's awesome. I love it.
What can technicians not do with a roll of tape and a tampon?
Seriously. Oh my God. Oh, that could be a whole other one where we talk about the craziest rigging that you've done in the hospital.
Yes.
To like rig something up to make it work.
Well, start thinking about your best tape and adapter story.
Yeah. I'm not super MacGyver in the ICU. We have other technicians that are like super MacGyver coming up with weird things, and I'm like, oh my God, how did you even think about that? But yeah.
Well, thanks for joining, Liz. This was
my pleasure. That was so much fun. We can do it a million more times.
We probably should.